dump starts with the DOJ, or Department of Justice. April 30th, 2019. Florida doctor sentenced to prison for tax evasion and disability fraud. Evaded paying taxes on over $1.6 million in income earned while claiming to be disabled. A Florida doctor residing in Hobie Sound, Florida, was sentenced to 51 months in prison yesterday for tax evasion, wire fraud, and Social Security disability fraud, announced Assistant Attorney General Richard E. Zuckerman of the Justice Department's Tax Division and U.S. Attorney Ariana Fajardo Orshan for the Southern District of Florida. According to court documents and information provided to the court, Arthur John Krantz was a doctor specializing in psychiatry. Beginning in 2002, Krantz made a claim on his private disability policy that he was unable to work and began receiving disability payments from his insurance company. In December 2003, Krantz submitted an application to the Social Security Administration for disability benefits. The SSA approved his application. Krantz then began receiving SSA disability payments. In addition to the private disability insurance payments, because of the disability payments, Krantz was required to notify his insurance company and the SSA if he returned to work. From January 2006 to March 2013, Krantz worked as a psychiatrist at a hospital in Pennsylvania and earned over $1.6 million in income. Krantz did not report his employment to either the SSA or his insurance company. Rather, in order to continue collecting disability benefits, Krantz took steps to conceal his income from the insurance company, the SSA, and the Internal Revenue Service. He directed that his income be paid to nominee individuals and sham corporations he had created to receive his payments. Krantz also filed personal tax returns that did not report the income from his work as a psychiatrist and provided fraudulent documentation to his insurance company that falsely stated that he was not working. In addition to the term of imprisonment imposed, Krantz was ordered to serve 3 years of supervised release and pay restitution of $1,013,284. Out of the Army.mil this morning, Vice Chief awards Silver Stars for Afghan Medevac mission. This was back on April 2016 and tweeted this morning. Nashville. When the first enemy bullet hit their HH-60 Black Hawk helicopter, Sergeant Armando Yanez and Corporal Emmanuel Bynum initially thought the loud bang was from the metal end of a tether that fell. Then mortar gun fire peppered the helicopter. By the time the 101st Airborne Division Air Assault Crew finished the medical evacuation out of a hot landing zone in eastern Afghanistan, nearly 30 bullets had struck the aircraft. On Tuesday, Army Vice Chief of Staff General James C. McConville awarded Silver Star medals to Yanez and Bynum, now a sergeant, for their heroic actions in the July 12th mission as they attempted to save a wounded Army Ranger. Every generation has its heroes, and today's generation is no different, McConville said after his speech at a conference hosted by the Army Aviation Association of America, or Quad A. Those two heroes risked their lives, and their valiant efforts symbolize the best of this generation. Medevac mission. While at Forward Operating Base Lightning, the aircrew Dust-Off 24 from the Division's 6th Battalion, 101st Combat Aviation Brigade, received a call around dawn to transport an Afghan soldier with a chest wound. As the helicopter approached the landing zone, they began to take small arms fire. We didn't realize we were being shot at until we actually landed, Yanez said. Yanez, the flight paramedic, jumped out and rushed 100 meters to receive the patient, who was then carried to the helicopter on a litter by Army Rangers who had been on a mission with Afghan forces. Bynum, the crew chief, and Sergeant First Class Andrew Sixth, a combat medic, also exited the aircraft to provide security. As the crew lifted off with the patient who would survive, one of the Rangers, Sergeant First Class Christopher Celis, stayed behind to pull security next to one of the landing gear tires. About 10 feet off the ground, Bynum said he noticed Celis fall down. After we picked up, that's when it dawned on me that he had been shot, Bynum said. Once in the air, the helicopter flown by Captain Benjamin Krzyzowski and Chief Warrant Officer 2 Jonathan Cole banked to the left and looped around while Bynum helped safely guide it behind a building. As the aircraft landed, a group of Rangers hurried to the door with Celis and helped load him in. Enemy gunfire still peppered the aircraft. While back in the air, Bynum said he glanced out of one of the windows and saw 2 bullet holes through the plexiglass. Bynum said he barely noticed the enemy gunfire during the rescue mission. I did what instinct told me to do, he said. We were just so focused on the mission, Yanez said. With the training that we'd done, we felt like we'd done this a lot. There was no panic from anybody in the crew. The true hero. As the helicopter quickly flew to a nearby medical facility, Yanez and six put all their attention on Celis, a 32-year-old assigned to the 75th Ranger Regiment. We did everything we were trained to do to try to save his life, Yanez said. Unfortunately, he didn't make it. Knowing what he knows now, Yanez said he would have done the same mission again. We're going to get him regardless, he said of Celis. We're not going to leave anybody behind no matter what. Measles cases and outbreaks. Measles cases in 2019, directly from the cdc.gov. From January 1st to April 26, 2019, 704 individual cases of measles have been confirmed in 22 states. This is an increase of 78 cases from the previous week. This is the greatest number of cases reported in the U.S. since 1994 and since measles were declared eliminated in 2000. The states have reported cases to CDC are Arizona, California, Colorado, Connecticut, Florida, Georgia, Illinois, Indiana, Iowa, Kentucky, Maryland, Massachusetts, Michigan, Missouri, Nevada, New Hampshire, New Jersey, New York, Oregon, Texas, Tennessee, and Washington. Measles outbreaks, defined as 3 or more cases, are currently ongoing in 2019 in the following jurisdictions. This is Rockland County in New York and New York City, Michigan, New Jersey, California and Butte County, California and LA County, California, Sacramento County, Georgia, and Maryland. These outbreaks are linked to travelers who brought measles back from other countries, such as Israel, Ukraine, and the Philippines, where large measles outbreaks are occurring. Make sure you are vaccinated against measles before traveling internationally. Measles outbreaks. In a given year, more measles can occur for any of the following reasons: an increase in the number of travelers who get measles abroad and bring it to the U.S., and or further spread of measles in U.S. communities with pockets of unvaccinated people. Reasons for an increase in cases some years. 2018, the U.S. experienced 17 outbreaks in 2018. 3 outbreaks in New York State, New York City, and New Jersey, respectively, contributed to most of the cases. Cases in those states occurred primarily among unvaccinated people in Orthodox Jewish communities. These outbreaks were associated with travelers who brought measles back from Israel, where a large outbreak is occurring. 82 people brought measles to the U.S. from other countries in 2018. This is the greatest number of imported cases since measles was eliminated from the U.S. in 2000. 2017, a 75-case outbreak was reported in Minnesota in a Somali American community with poor vaccination coverage. 2015, the United States experienced a large 147 cases multi-state measles outbreak linked to an amusement park in California. The outbreak likely started from a traveler who became infected overseas with measles, then visited the amusement park while infectious. However, no source was identified. Analysis by CDC scientists show that the measles virus type in this outbreak was identical to the virus type that caused the large measles outbreak in the Philippines in 2014. 2014, the U.S. experienced 23 measles outbreaks in 2014, including one large outbreak of 383 cases occurring primarily among unvaccinated Amish communities in Ohio. Many of these cases in the U.S. in 2014 were associated with cases brought from the Philippines, which experienced a large measles outbreak. 2013, the U.S. experienced 11 outbreaks in 2013, 3 of which had more than 20 cases, including an outbreak with 58 cases. In 2011, more than 30 countries in the WHO European region reported an increase in measles, and France was experiencing a large outbreak. These led to a large number of importations, 80 that year. Most of the cases were brought into the U.S. in 2011 came from France. 2008. The increase in cases in 2008 was the result of spread in communities with groups of unvaccinated people. The U.S. experienced several outbreaks in 2008, including 3 large outbreaks. From WHO.int, vaccines work. For health workers, the death of a child always strikes hard, but this tragedy is felt deepest when it's due to a disease that is readily preventable with a safe, effective vaccine. Professor Berthold Koletzko, a pediatrician from one of Munich's largest hospitals, has seen firsthand the alarming consequences of children missing out on vaccination. This has led to their exposure to illnesses that, in Europe, he'd once thought confined to a distinct past, diseases like measles or tetanus, which previously he'd only seen while overseas in his youth. What we are seeing is that more parents are no longer aware of the dangers of these diseases, When I grew up, many of us knew children who were damaged because of them. We, in the hospital, still see their impact, but for newer generations of parents, it can feel much more remote. According to preliminary WHO data, measles increased by around 300% globally in the first 3 months of 2019, compared to the same time last year, with sizable rises in all regions of the world. The reasons for children not getting the vaccines are diverse. The majority are the consequence of fundamental lack of access to vaccine services, with sub-Saharan Africa, which has the lowest coverage, accounting for the largest part of the increase and the greatest burden of cases. However, in places with historically high immunization rates, complacency, whether from parents, health providers, politicians, or governments, can also play a role and comes at an extremely high cost. Thank you for watching this installment of the Government Dump. If you wish to support this channel, you can like and share it out. You can subscribe, hit the bell, and comment down below to continue the conversation. Also, all links can be found in the description below for the articles read, as well as further information on how to support the channel.